Hello, everyone, and welcome to another episode of The Pulse, where we talk to digital health influencers, experts, and entrepreneurs from all over the world. And season one comes to an end, and I launched season one with Dr. Tazeen, and it only made sense to wrap it up with her as well. I want to get her insights and her take on what she thought we of season one, and so many amazing guests were there. We discussed so many important topics. So, Dr. Tazeen, in your words, recap of season one, what you thought about it.
Okay. So there was a lot that was discussed and really, really great things that were highlighted. And we had great guests and with really, really insightful and thought-provoking discussions, I think, which was Maida, our aim with Pulse as well, that we
Yeah.
wanted people to come on this stage and really talk from the heart as what are the challenges and where do they want to see health tech, how do they want to see health tech transforming the current challenges the health ecosystem is facing. And I think the discussions were really nice. And I think what our aim also was with launching Pulse was that we sort of redefine or reassess where we are in terms of the healthcare delivery models. I think post pandemic, all of us have had to pause and see, is it really working? Are these systems really working?
Yeah.
Is the healthcare industry ready for the future?
Yeah.
Future of probably involving technology, any future pandemic, the lack of resources. Are we really ready to address those challenges? And I think we had great discussions. And I'm really excited for season two.
Yes, and I'm so glad you touched upon, and you addressed the gap, or at least addressed where we are right now, our current stage in terms of the innovation that the healthcare industry is experiencing. And, we started off with some guests that were talking about mental health and the use of digital technology in mental health. There are a lot of telemedicine and telemental health platforms as well, but I think it extends beyond mental health as well into physical and emotional and overall well-being. And you being, a digital health expert with a 15 years experience, how have you seen the trend change, and how do you think that we can leverage technology for overall well-being?
Yeah. So actually, we all are part of this paradigm shift, as I say. This entire concept of health, I think, needs a redefinition, and I think it actually started. So we've always been very focused on illness and treatment of diseases. I know, obviously, we have been managing chronic diseases and preventable, non-communicable diseases, but I think right now we're at the brink where we really are focusing on preventive models of care, not only in, I think, mental health. Right now, I think we all are a part of this narrative where we are redefining health. We're redefining health as a complete package, which means social, physical, mental, emotional well-being, and not only in your home. I think the best thing about what technology has given to us, we're taking care out of the clinical setting. We're taking care out of a traditional hospital setting. Now we are promoting care with leveraging technology from the home, from the offices, and mental health being such a sensitive area where we always talk about that people who have mental health issues have difficulty actually talking to someone, obviously with the stigma attached, and just getting the courage to get up and can really aid this in a way where people can now talk to mental health experts from their home or from their work or from wherever they are. They don't really need to be seen in a therapist clinic. So it just gives them a feeling of comfort that, I'm in my space and my whatever secret or my mental health issue is mine alone and nobody knows about it. And that's why I think mental technology has been able to address some of the issues of mental health. And taking from mental health, I think it just been better at preventing as well. And I know during the course of our discussions we talked about leveraging technology. When you talk about digital health tools. We're talking about wearables, remote patient monitoring tools, and how remote patient monitoring tools right now have become part of our lives.
Yeah.
And we all at some point are either wearing a gadget or monitoring our sleep. And all of these small vitals or small pieces of information actually give the doctor or a healthcare professional a peek into your mental health state. So, where a window of opportunity is here where we can actually prevent those issues from becoming much severe, or have focused interventions, in individualized interventions for each individual through digital technology. So I think yes, it has a huge impact not only in mental health but overall in holistic well-being.
I'm glad that you mentioned that we have taken care, or technology has enabled us to take care out of the clinical settings, and it's nice to see that lingo like the number of step counts that we have per day has been worked into our conversations, into our daily conversations, which implies that people are being more mindful and more are taking active steps in their well-being. Let's shift our focus to clinical entrepreneurship. So we had a couple of guests who were clinicians, but also entrepreneurs. They're again doing amazing things in the healthcare space. And I think the pandemic was one of those times where clinicians had their light bulb moment, and they really saw that they could contribute to other areas of healthcare outside of mainstream clinical medicine. And I know that you're a clinician as well, and you've been an entrepreneur and now an entrepreneur. So, what are your thoughts on that?
No, it's absolutely amazing to see. And it's amazing to see that we are, I mean, pushing the envelope a little, I mean, in the realm of care, I mean, not going out of the healthcare ecosystem. There's so much more than a doctor can do. And I think we, again, like we put the healthcare in a box, I think we've put doctors in a box, we've put nurses in a box. So we have this defined definition of what a healthcare professional or doctor should do.
Yeah.
But I think that's what is so amazing with technology. Not only technology, with this new world of clinical entrepreneurs, that now people are experimenting. There's so much more we can do, and there's so much more impact clinicians can do. Again, not exactly out of the traditional clinical settings, within the realm of clinical settings, but doing different things. Now, I mean, I know some very amazing clinical entrepreneurs. Some were on your podcast as well. Some we see and are in are friends with, that are doing amazing work. There's so much to do. We are seeing an era of empowered patients. Their needs are different.
Yeah.
When your consumers' needs are shifting, it's I think to manage that, the clinicians' focus should shift as well.
Yeah.
And that's why I think I'm really glad that I'm in this digital technology space, although I was here 15 years ago when it was digital health was not a thing. But it's just so I mean, I'm really glad to see more and more doctors exploring different opportunities, exploring different avenues to make a difference. And I would say you're one of them as well. I mean, you're a clinician. And I mean, how has your experience been in the digital marketing and communication space?
Yeah, so I haven't been in this space for as nearly as long as you have, but for me, it was more about finding an alternative career or a means of an alternative career. I was not, and you know how you mentioned that people have put clinicians in a box, but I think it was interesting because I was having a conversation just yesterday with another clinician entrepreneur, and she said sometimes clinicians ourselves, we put ourselves in boxes as well. So maybe due to lack of awareness, I was not even aware that there were other options for me, where I could combine my clinical knowledge with, say, my creative skills. Or you, for instance, you found your own way. I know a lot of people that are focusing in the digital health space in public health, or in digital therapeutics, and or in the metaverse, in emerging technology. So I think, and this was one of the reasons, and this is a really big gap in the market that we saw when we started working together, Dr. Tazeen, that there was a lack of clinicians being at the forefront and leading these processes. Because like you said, once the behavior of the patient changes, the shift needs to change, and the focus needs to change
Absolutely.
towards
Otherwise, you have these unmet patient needs that
exactly.
we so often talk about, that the patients are becoming empowered, the patient behavior is changing. We are in a new digital population,
Yeah,
which have been using phones and digital gadgets since they were, I don't know, maybe a year old.
yeah,
So the entire dynamics of the population is changing, and it was not possible if the healthcare industry or the clinicians did not change. Then
yeah.
we would have this huge gap. And it is so nice to see so many clinicians, I mean, looking at that gap, identifying that gap, and then embracing the change that is coming with this digital transformation.
Yeah.
So, clinicians, I agree with you, we put ourselves into boxes as well because we kind of are trained to think in a
Yes.
certain way, right? We were never trained entrepreneurship. We're not trained in
To
technology.
think out of the box.
Yeah, think out. We're very, very, these are the facts. Eight, one, two, three are the three outcomes that you can have with you have these facts. So that's kind of the opposite of being, creative
Yes.
or being entrepreneurial. We were always very fact based, which again is something that's a skill that is great in technology, because that's where technology really augments the clinical systems,
Yeah.
is based on this data that technology is collecting. You can actually create and develop clinical decision systems that can reach to conclusions much faster than a human brain. So
Mm.
basically, the clinicians of today have a great opportunity to use these clinical tools to augment their way of working, their processes, to just to make better treatment decisions. And it's I think it's a win-win. I mean, the doctors have less stress on themselves, and the patients are happier as well.
So when we talk about happy patients, we're also talking about patient-centric systems and patient-centric care delivery models. Like, again, I'd like to reiterate that it's all about the patients being in the driving seat now. So tell me a little bit about that. What kind of conversations are you having with industry experts when it comes to
Yeah.
patient centricity and patient-driven healthcare?
Yeah, yeah, that's a very good question. So we, as you said, we started off with patient-centric healthcare, and we this is something that we use very often. Oh, it's a patient-centric system. It's a consumer-centric system. But I think right now we have moved to a patient-driven ecosystem. As I said, that the dynamics of the population are changing. We are seeing a much more digitally enabled population, digitally enabled patient. So now, because of COVID, we now have patients who actually want to use digital tools to take care. They are already wearing these wearables. They are more involved in their care. They want to know what they're eating. They want to know how much they're exercising. As you said, the step count, very small thing that I think all of us say, oh, I need,
I haven't got
we
my
need to
steps
become,
in. Yeah.
how many steps I did today, or people wearing the Aurora ring, seeing, oh, how did I sleep today?
What my
How
calorie
many
count was
hours
today.
how
Yeah.
much calorie count was.
Yeah.
So we are moving into this generation of patients that is that aware and wants to drive better treatment outcomes. So now we are moving to patient driven ecosystem. And the good thing about these patient driven systems are that they are based on prevention. They're not based on treatment,
So it's more
because they
proactive and not.
proactive. They want to know, okay, right, if I'm pre-diabetic, for example, what should be my diet? If I have a familial, predisposition to a certain illness, what should I do to prevent it?
Mm.
Now, I think that's where it's so amazing that we can actually improve population health. And
Yes.
if that's the shift healthcare is taking, then we're looking at, not now, it's still 10 more years to go, but maybe we're able to reduce the burden of diseases on countries,
Yep.
on the entire
Economy.
healthcare industry.
Mhm.
Because right now, COVID just showed us how vulnerable our systems are. And I'm not talking about developing countries. We saw the developed countries' healthcare systems crumbling,
Yep.
with lack of resources, with lack of preparedness, sheer lack of preparedness, I would say.
Yep.
And I think it was a wake up call for all of us, for the patients and the doctors as well. And
So entire healthcare systems, right? COVID has
yeah,
proven to
and
be an equalizer.
I think if anything, anything, even positive, that has come out of COVID is this, that people have recognized that technology is an enabler, is a tool that can be of benefit to the doctors and to the patients.
Right. And so when we're talking about patient centricity and, like you said, patient driven healthcare system, that takes me to my next point, which is the consumerization of healthcare. And that's also a trend, being from the marketing background, that's a trend that we've seen. As a marketer, I can speak for it, that again, we see a shift in the behavior, in the consumer behavior. And historically speaking, patients have not been treated as consumers. They have usually been taken as passive sort of collaterals in healthcare. But today's patient is so much more involved, so much more empowered. They have so much more influence and control in their own healthcare decision making that they are actually who are driving the shift in the innovation that we're seeing in the healthcare system as well. So I think more and more experts are also realizing that we need to involve patients as well at the individual level, at organizational levels, but also at policy and decision making levels, and utilize sort of their own unique experiences, like you said, in delivering personalized care. I think that's where we can involve patients and then engage them more. When we talk about patient engagement, it's all about increasing the awareness and then ensuring that experts use the best practices of health communications to sort of close that communication gap as well. Which is one of,
That's why we see a lot of people are now saying patient advocacy groups.
yes,
They are taking active part in designing how the system should look like, where we are today and where we want to be tomorrow.
right.
Again, it's a collaborative effort. Patient are the end users of your systems. They need to be involved in every phase of your, not digitization, every phase of this paradigm shift towards better care delivery models across all spectrum of healthcare.
Yeah, and so this was one of the challenge. I think this is one of the challenges in digital health adoption as well, because there's such a huge gap between the digital information out there, but then the user access as well. So let's talk about the challenges of digital adoption a little bit. There is a communication gap. We'll get into that a little bit on. But other than this, what do you think are some of the major challenges in digital adoption and frequency of usage?
Okay. So as we were talking about patient centricity and patient being a consumer that has been really passive, that's one. One patients are one consumer or one user of the healthcare system. But I think when we talk about adoption, we really cannot forget the healthcare professionals, the nurses, the pharmacists, the doctors, the surgeons, everybody that is at the other end giving care, right? We actually need to be very focused on improving both the life of both of our consumers, not just one, because it tips the scale to one side. So we have to develop systems that the care professionals understand before they can use it. Now, we can't take it for granted that, oh, this system is so easy and this system is so great that when I present it to a doctor, there is an, oh my God, I'm going to start using it today. No, that's not how most of the things work. What we need is proper training, proper capacity building of clinicians, which is lacking right now in our entire education system and in entire healthcare ecosystem. We are just assuming that we're going to create digital tools and the doctors will jump on board immediately without any training or understanding of the tool and start using it for their patients. I mean, that's not going to work. That's why we see a lot of noise out there. I'm asked this question a lot that, oh, but doctors don't want to use technology. And I said, you know what? No, we can't say they don't want to use technology. We just not making things easier for them to adopt technology.
Yeah, so basically tools that integrate within their clinical workflows.
Absolutely, yeah.
So they don't have
augment the systems. I always say augment the existing system. Don't come and say to a clinician, you know what, I have a system for you. You scrap whatever you were doing. My system is perfect. From tomorrow, use this. No, you do tiny steps. You take small wins, augment their existing issue, address their immediate need. That goes for both patient and the care team. Address their concern first.
Yeah.
If you want to talk about improving adoption, address their concern first. Involve them in what you are proposing to them. Before you say, okay, this is the system, I know it's best for you. No, you involve them in, if it's a, let's say, it's a bespoke technology platform, I would say involve them in the design phase. That's why you and I are such an advocate of clinician-led technology platforms,
Yes.
patient-driven technology platform, where the consumer is in the driving seat.
Yes.
Because again, I keep saying this, technology is only a tool, is just an enabler. We have to humanize this relationship between patient and doctors. And if the two people who are the most important are not part of this
Yeah.
discussion, then you are ending up with solutions which maybe sometimes people don't even need.
Do the opposite. Have the opposite effect.
Yeah, and they don't need. um I mean, adoption is one, we don't have, we don't involve the end user. But again, when you talk about adoption, there is a gap between communication, not only between technology industry and the patients. I think there is a lack of communication or skills and training between, for the clinicians as well,
Yes.
which is an area I think you and I again are very passionate about, is
Yes.
improving the clinician skills.
Clinician skills and also communication between the healthcare professional and the patient as well. Because, I see a lot of communication assets going out regarding health awareness, regarding public health issues, communicable diseases, even in the pandemics. Just it's a lot of information for the patient to take in. And, considering the changing landscape of marketing communications, we need to understand that patients, they don't, they're consuming so much content already on a daily basis, that they just want need to know information, not nice to know information. And so that's really where, our sort of skill set also comes in. I think that it's where we break down complex information into digestible and understandable bits for the patient, whatever
Absolutely. And
the
it's
target.
just about, again, there's a lot of clutter out there,
Yes.
right? I mean, even if I go and start looking at researches in different companies, which is great, but then for a clinician also, Maida, I would say clinician and patient both, how can you decide this
Yeah.
is what I need? So you really need to improve the communication, messaging, content
Yeah.
for patients and the doctors.
Doctors and other stakeholders involved in healthcare as well, because
Absolutely.
this is what we
Pharmacists. You
see.
talk about pharmacies. Yeah, we talk about
Pharmacists.
digital
Yeah.
therapeutics.
Yeah.
I mean, just I find that even defining that term to a non-technical person is, oh, what is digital therapeutics? It
Yes.
just, I mean, these are things where we need a lot of focus needs to be given.
Yes, and
As
we are in an era of information overload and or infodemic, like it's described now. So we really need to build more reliable and trustful resources for our target audience, whether that's a patient, whether that's a doctor, whether those are from non-clinical disciplines. And so while we're talking about the challenges, so you explained beautifully how there's these gaps are, but I think this security and distrust is also one of the challenges. And which brings us to emerging technologies about why blockchain has so increasingly been popular and adopted in healthcare. What are your thoughts on that?
Yeah. So again, as I was mentioning, that technology is a tool, and we are talking about a very private relationship between a patient, a very confidential relationship between a patient and a doctor.
Yeah.
And I think when we introduce technology, it becomes a third party, right? Or there's another person that is in the room listening, because there's a computer where you're putting information. So trust in your digital system is very important. It goes both ways for patients and for doctors. How secure are these systems that we continuously talk about? Oh, technology is great, but if we are putting in our sensitive information, how vulnerable it is to threats, how stable it is, and
Leaks. Yeah.
I mean, I think a lot of people don't trust the system because they don't even know what their privacy policies are. Who
Yes.
has access to this data? How many, if my doctor has it, who else in this hospital can read my
Has
information?
access to it.
So, because I think we need to again give information to a patient whenever they're using any sort of technology, that this is your information, this is who has access to it, and if at all we want to share this information for continuity of care, for example, referrals and other things, we will take consent. That's why I think this
For
discussion
research
of
purposes.
consent
Yeah.
is so important with patients.
Yes.
And that's why I think when technology became mainstream, in especially EMRs, where we were quoting down pre-existing conditions of patients, that's where we started realizing, you know what, these central databases, where one database has all the information of, I mean, tens and thousands of patients, are not secure, and one single threat can actually cause the entire data set to be vulnerable.
Yeah.
That's where I think we talk about blockchain now. Now, why people are in technology and in healthcare as well, talking more about using blockchains and using smart contracts, is because of this vulnerability of the central databases. And that's why I think blockchain brings a new dimension to systems which are more secure, and the patient has more control over their data. So I think emerging technologies are doing great, and not only blockchain. We're talking about machine learning, metaverse, AI, robotics, and all of that are great addition to digital health technology. Of course, they have to be implemented by uh, proper guidelines and guardrails. We need to ensure that the patient data is protected at all times, and the patient is aware of who has access to their data. Only then we will have this trust in the new systems.
Yeah, no, that makes sense. And I think one of the really good use cases and examples or applicability of decentralization was in clinical trials, right? Where we have decentralized clinical trials. And that has really helped in the research and in gathering information and data and then producing results off of that.
Yeah.
And I think that we've
We're
written about
talking about the data sets which are not inclusive enough. And we saw that with COVID, where we found out after the vaccine was worldwide, you know, we had implementation that it wasn't probably tested on all population segments. So yes, it's decentralized trials is great. It just improves the inclusivity and can, you know, really produce medicines and research that represents, if not entire, but at least majority of the world's population.
And you mentioned the metaverse, and I know that metaverse is being used in data security as well, but also in medical education. So it's we're making new and improved and engaging engaging means of just study materials and for medical students, and also simulation training exercises. So metaverse is doing a lot of there's a lot of buzz in the metaverse regarding medical education, and I know that's something that we talk about as well. What do you think? Where do you think medical education is headed, and especially for this generation, for the coming generations of medical students? Because we say that medical students are also one of the most important stakeholders of the healthcare ecosystem.
Absolutely.
And they're digital natives, so they need new and improved tools. Yeah.
I think medical education needs to be revamped.
Yeah.
Again, because our consumers are changing. And not only, I'm not talking about the patients here.
Yeah.
You're talking about a digitally enabled population. I mean, doctors that are in this era that obviously use technology more than I think you and I did. Now we have AI systems which can predict fractures with 99% accuracy.
Yes.
We didn't have that growing up. So we're talking about a population or new set of doctors that understand technology. But are the systems really changing to meet their needs?
Yeah.
Or so that they are able to survive in this digitally enabled ecosystem? I think no, they're not. So we really need to focus on giving or empowering these students with enough digital education or digital health literacy that they're able to survive in this digitally enabled health ecosystem. And that's where this entire cycle will improve, where they will know digital technology before they come out of med school. They will know how to use it, and then they will be able to adopt it better, adopt it faster, making better clinical decisions and improving healthcare, which in turn improves population health, making patients happy. So it's kind of like a cycle. And if with so many components to it, and I think the starting point is empowering our students, our new doctors with digital technology, which information, but then I mean information that enables them to choose the right technology as well. I think right now with so much noise out there, like everybody says that my technology or this app is the best. How do they know which one is best for them?
Yeah. No, absolutely. And I think that it's just the starting point, right? Like you start, like you said, it's a cycle. You start at point A and then you work, it just has like a ripple effect. And the effect keeps on going and it produces results and long-term outcomes, I guess, when you start with medical students. And you mentioned digital health literacy. That is something that we also talk about. We're very passionate about as well. But that was in the context of medical students. And, digital health literacy is lacking in patients as well, right? Because again, this is where that communication gap comes in, because not everyone has internet access, not everyone has the awareness of which resources to use, where to use, how to use. And again, like there's so much misinformation, so much information online. Patients also, and because now they have more care options more than ever than they ever had before, so this is all very overwhelming for a patient that's already distressed, already going through a lot in terms of health. What do you think are the most important things to improve digital health literacy today?
Yeah. So when we talk about digital health literacy and talk about digitally enabled population, we've been talking about the population is changing, we are empowering patients. We shouldn't forget that there are more than 3 billion people in this world that don't have access to internet.
Yeah.
So they can't even, we're talking about that they don't probably have access to any of the digital tools that we are talking about, right? But even with the population that have internet, are everybody that has access to an internet and has a smartphone, do you think they're digitally enabled to use a health app? No.
No.
When we talk about digital exclusion, it not only covers a smartphone or internet connectivity, it's about culture, it's about language, it's about education, it's about gender. So digital exclusion is really big. It's not about, oh, they can read and write or they are able to, navigate through the app. Not everybody with a phone can navigate a health app.
Mm-hmm.
So digital health literacy is key right now. If we want to talk about penetration of digital technology in the mainstream population, digital health literacy is the only key that's unlocking that door. And not only making them or giving them a smartphone and a satellite internet connectivity in some remote area. Oh, you have a phone, you have an internet connection. Now go speak to your doctor online. They don't know how to.
Yeah.
They've never done it. So that's a skill set. Again, that's a gap that I think has been identified. But when we are rolling out digital system, focusing on digital health literacy of both the doctor, which obviously has different outcomes, but for the patient and the population as a whole, is huge. And when we talk about gender and culture, a lot of culture. I mean, I worked a lot in developing countries where giving a smartphone to a female is considered, oh, that's not appropriate. She will be talking to people she shouldn't be talking to. So we're talking about a cultural shift. It needs to come with effective change management, with effective, I would say, strategies that are embedded in this transformation. Sometimes I feel, oh, digital health literacy is here, technology is here, patients are here, doctors are here. No, digital health literacy should be embedded. Humanization of technology should be embedded in this transformation. It should not be, oh, it's a tick mark. We gave them training, we gave them support, we gave them a smartphone, we gave them internet, but they're still not using it. We need to think about how we want to bring this change that we want to see. We have to build the cultural sensitivity, the gender, not the stigma, but just the challenges that are around digital exclusion in this world.
Yeah.
build that in our transformation process. Only then we can say, you know what, we've done everything we could to enable the patients. And now, obviously, um, how will they embrace technology and make it a part of their healthcare?
Right. And so, in other words, just to summarize what you've said, is that to remove the systemic barriers that we have and really work towards health equity, right? So, just to make sure that everyone, and look at this with a holistic perspective. And not, and like you very nicely, said that we can't keep on working in silos and we can't keep on put them in boxes. We have to sort of look at it and work together for optimal outcomes. And just to wrap it up, healthcare ecosystem is what we all are talking about. I see you putting out a lot of posts on LinkedIn as well. I see a lot of other industry experts talking about the healthcare ecosystem. And that's what we're actually basing season 2 on. And so we're going to have we have an amazing lineup of guests from each segment of the healthcare ecosystem. And just to wrap it up, what do you think we're headed, and how should we go about in improving the healthcare ecosystem and all the stakeholders within it?
So I think when we had this idea of season 1, Maida, we were thinking about bringing out people that we thought needed a platform to say what they want to say. And I think that was kind of the icebreaker, I would say, season 1 for what we want to do. And I think season 2 just brings in every driver or every key stakeholders from the ecosystem. We're talking about entrepreneurs with smart ideas. We're talking about venture capitalists. We're talking about people who want to invest in new ideas, talking about people who are investing their time and effort in digital health literacy, female entrepreneurs in STEM. So I'm very excited about season 2 because I think we want to actually take everybody along this journey now. We want to have pharmacists and lab technicians and even anybody who has a brilliant idea and wants to make a change to come on our platform and discuss it. Because again, as I said, it's a collaborative effort. Unless we all work towards the same goal, it still take us many years to get where we want to be, but I think it'll take even longer if we keep working in silos, if we keep thinking that we don't need the other person. All of us needs help from the other stakeholders, and it's definitely a collaborative effort.
Well, thank you very much for your time, Dr. Tazeen. And we're all about starting conversations. And I urge to anyone who's listening or anyone who's watching, if you have a great idea and you want to participate or be a part of our podcast, reach out to us. We'll have the email address and the contact information on our LinkedIn page, in the YouTube caption below. And for everyone else who's listening, stay tuned for more updates and exciting information. Thank you.
Thank you, Maida.